If you're worried about side effects on a GLP-1 medication, this episode might help. Hi, guys. I'm Alex. I'm your nurse, and today's episode of Health Recoded is going to be about GLP-1 medications, their common side effects, and how to manage them. GLPs have become increasingly common lately. They're getting prescribed more and more for weight management, diabetes care, and metabolic health. With that popularity can come a lot of confusion, fear, and misinformation, especially around side effects. Today's goal is not to scare you, it's to help you understand what the medication is doing, why side effects occur, and then what we can do in order to improve them if they do occur. So, hopefully, understanding the physiology will actually help to remove a lot of unnecessary anxiety. So, a quick overview: what does GLP-1 do? GLP-1 stands for glucagon-like peptide 1. This is a naturally occurring hormone in your body, and it's produced in the gut in response to eating. So GLP-1 hormone in your body, it works by slowing gastric emptying, increasing feelings of fullness, and reducing your appetite. This is all in an effort to get you to stop eating and therefore control how much food that you're actually taking in. And so, therefore, as a result, this helps to support our insulin release and manage our glucagon secretion. This is the same mechanism of action with the medications. These effects are helpful, but they also explain why the side effects occur in the first place. So, why side effects happen? They are physiologic response to the medication's effects of slowed digestion and altered gut signaling. So these side effects happen because of the mechanism of action of the medication. Your GI tract is being asked to function differently when you inject more of these GLP-1 medications. Food stays in the stomach for longer, signals between the gut and the brain change, hunger cues are suppressed, and fullness signals are amplified. So the body needs time to adjust to these. This is why we start on a low dose of these medications. Starting on a large dose of GLP-1 medication initially will greatly increase your risk of severe side effects. So when you're getting started on a low dose instead of the max dose, that is exactly what should be happening. This is why side effects are more common at the start, more common after dose increases, and often temporary. Your body is adjusting to this new amount of GLP-1 that is being introduced to it. And so as a result, because it's doing more of what it naturally already does, you're having these side effects occur, which we'll get into and talk about in a second. But it's a natural response to this GLP-1 medication. It doesn't mean that there's toxicity or a reaction per se. Some of them could be, but it just means that the body is dealing with this new thing that you're giving it. So the most common side effects and why they happen. Nausea and heartburn are probably the two most common ones, and this is in response to the delayed gastric emptying, the increased fullness signals, and then food remaining in the stomach longer than usual. So because your stomach is not emptying as quickly, the food is staying there for longer. And then because you feel fuller, if you take in the same amount of food that you were taking in before, then that becomes too much for your system. So then you'll start getting reflux or nausea because that food is sitting in your stomach for so much longer. So some management strategies for you is to eat smaller meals once you start, portion your meals out throughout the day, eat more slowly when you do eat, and then avoid certain foods, particularly high fat, spicy, carbonated, or really heavy, dense meals. And then stop eating at the first sign of fullness because we don't want to keep packing on food on top of that. Nausea improves as your body adjusts to the medication and your gut adapts. So ideally, once you start the medication, these are administered once weekly, typically. So you'll see the most effect for the first 1 to 2 days on average, maybe for the whole week, depending on people and how their body responds. But as you get closer to your next injection date, it's not uncommon for these appetite changes and these signals to decrease. So in response to that, you may feel more side effects when you inject and then less side effects closer to your next injection date. So as it tapers throughout that 7-day period. This also comes into effect when you increase the dose as well. So you're putting, again, more of this GLP-1 in your body, and your body is having to adjust and respond. This also leads to vomiting, though. I know this is a big one that people are always scared about. It's less common, but it can occur. So if you're experiencing the nausea or the heartburn and not responding appropriately, so you're still eating these irritating foods, or you're eating a lot more food than you should, that will then your body will say, I can't hold all that you're giving me, and so I need to eject it and I need to get rid of it. So vomiting is less common but often occurs, especially with large meals, high fat foods, and rapid dose escalation. And part of the catch with these side effects that you'll find is the initial side effect is less so much of the problem. It's when it gets away from us and it leads to other side effects down the road, like dehydration or dizziness or hypoglycemia, that we're really concerned about different things going on with your body, because it basically snowballed and got away from us. And now we're dealing with a more severe presentation. So again, this is why we start on lower doses of GLP-1 medications. So management for vomiting: reduce your portion size, avoid heavy meals, ensure adequate hydration, and avoid lying flat after eating if you can. There's a lot of patients that'll say they feel nausea or heartburn increased after they eat dinner. So particularly if they eat dinner late in the day, they'll feel it overnight. So they'll say, yeah, I had a lot of heartburn last night. I don't really know why. Well, maybe they had a glass of alcohol or they had a spicy meal and then they went to bed an hour later. So they're laying flat. And so your body doesn't have to fight gravity so much to push all that out, essentially. So sit upright for a little bit after a meal and maybe push your dinner a little bit earlier in the day. The concern here with vomiting: persistent vomiting should always be reported to a provider. If you are not able to keep anything down for 24 hours, you would be best advised to seek in-person evaluation. The risk here is, like I said earlier, worsening dehydration if you're unable to even keep any basic fluids or water down, okay? Leading on to constipation. Constipation occurs due to slowed GI motility, reduced food volume, and reduced fiber intake from eating less. So again, if the food is sitting in our system for longer and it's not passing effectively, we want to hydrate to help that move. But if it's sitting there, the body isn't digesting it as it should sometimes. And so if we're putting lots and lots in there and that processing is slow, that can lead it to just kind of sit in your gut for longer than it should. So this is why I always advocate for hydration and fiber, because the two go hand in hand. Appropriate fluid intake is 64 ounces a day, roughly. And don't be afraid to use electrolytes. We want daily movement as well, physically movement, like walking, exercising, doing some stretching or yoga, whatever that is. And then our fiber-rich foods, you can go see the fiber episode to learn more about that specifically, but broccoli, cauliflower, sweet potatoes, things like that. I'll always recommend psyllium husk to patients. I think you mix it in water and you could take it in the morning, but it's a really easy way to get something down that improves your function and your regulation without having to take in a mass quantity of food. Because a lot of people complain, I feel so full, I can't take anything else in to improve my fiber and my gut motility. And then ultimately, laxatives or softeners, if they're needed, such as Miralax or Colace, we want to be very careful with these, because this can actually, if you rely on these or you take these too continuously, they can actually cause rebound constipation if you take laxatives too often. So just be aware of that. And if you do take them, make sure you're hydrating as well. Constipation is very common and very manageable, but if you have not had one bowel movement in 7 days, this warrants further attention, and please go get evaluated in person, okay? The opposite side of that, though, is diarrhea. Some people experience diarrhea instead of constipation, and this can be due to the changes in the gut signaling and the digestion, irritating foods irritating the intestines, and then changes in the gut bacteria from these medications. So management for diarrhea is monitor your trigger foods, kind of the same thing with heartburn. Lactose products and spicy foods tend to be the most triggering for most people's systems. We want to maintain hydration as well. This is a big core component when it comes to GLP-1s, okay? And then if the diarrhea is persistent, you could consider Pepto-Bismol because that will help to regulate it, but Imodium as well if needed. That being said, if diarrhea lasts for longer than 3 days, this is when you want to go get evaluated in person. This is similar to vomiting. If you are not able to adequately replace what is being lost by your body, then this could lead to further concerning side effects such as dehydration, okay? Another side effect that comes up, I don't know if I would necessarily consider this a side effect as much as a change, but appetite changes and food aversions. So people will experience reduced appetite, right, because of the fullness, but they can also experience a change in their they can also experience a change in food preferences or changes in the way that food tastes. So people report a less desire for alcohol, less desire for sweet things, or even changes in the way that things taste, like things will taste more salty or taste even sweeter. And then as a result, they'll actually dislike some of their previously favorite foods. This is not a psychological effect, it's a part of that change in the gut brain signaling. So, GLP-1s have been shown to have effects on the reward pathways in the brain, and this also results in the way that your brain perceives food. So, this is part of the alcohol thing. People will report that they don't have as much interest in alcohol, and it's because it's working with those reward pathways. And this also speaks to why you experience less food noise when you start taking a GLP-1 medication. Fatigue and low energy is another one. Some people report fatigue, especially early on. A lot of this is related to reduced calorie intake, and so therefore your blood sugar is shifting, and then dehydration, so therefore you're experiencing an electrolyte imbalance. So management for this is ensuring adequate caloric intake, maintaining your hydration, and then don't over restrict yourself on food, particularly carbs. Your brain needs carbs and sugars in order to function. It's okay to fuel it and give it that. So, fatigue is often related to underfueling rather than the medication itself. So, it's more of a response of the medication, if that makes sense. So, you started the GLP-1 medication, you basically stopped eating and hydrating appropriately, and then your body is now saying, I don't have enough to work with, so I'm really tired and I'm not going to work. So, we just want to make sure that we're focusing on our hydration and our nutrition, if you can see a pattern here, when we start these medications. This one's also kind of related to dizziness and headaches. Headaches can occur and dizziness as well because of dehydration and reduced food intake, and then the electrolyte shifts. So, same advice here. Improve your fluid intake, or rather, make sure it stays at least 64 ounces a day. Add electrolytes as you need. And I want to make a disclaimer because I know I've talked about electrolytes a lot. I'll have a lot of patients come in and say, I've been adding electrolyte supplements and I drink like 5 a day. That's a lot. I would recommend probably no more than 1 up to 3, depending on who you are and what you're doing. If you're an endurance athlete and you're doing all the training in the world, you might need 3. I don't even drink more than 1 or even half of 1 in a whole day. I would probably advocate for 1. Be careful of the ones that you're taking in. Some of these have lots of sugar and lots of calories. And that's not to say that they're bad, but a lot of people don't realize how much they're actually taking in, and those are sneaky ways that you can actually be taking in a lot more sugar and calories than you realize. So I'm not trying to throw electrolytes at you the whole time saying that you absolutely have to have one. When I'm saying electrolytes, I'm saying eat your nutrients or drink them. This could be eating berries or hydrating fruits and vegetables like celery, the berries, watermelon, things like that. If you need the electrolyte supplementation or some Gatorade or Pedialyte or something like that, these are amazing ways to help make sure that we're getting balanced nutrition and hydration, okay? Eating regularly, even if portions are small, is another management tip for headaches and dizziness. And then ultimately, Advil or ibuprofen for headaches as needed if they're not going away. If they are severe or persistent or related to vomiting, then I want you to go get evaluated in person because that's warranting further attention, and that's a little bit more concerning, okay? Okay, less common but important side effects. Gallbladder issues, pancreatitis, and vision changes is what I'm going to be talking about today. So gallbladder issues. So rapid weight loss increases gallstone risk regardless of the method. This is because it increases the gallstone risk by altering bile composition and reducing gallbladder function. The process causes the liver to secrete excess cholesterol into the bile, which simultaneously causes the gallbladder to contract less and leads to bile stagnation and crystallization. So therefore, it creates gallstones in this situation. And this is just rapid weight loss, right? We're not talking about GLP-1s causing gallstones. It's the weight loss that you experience if it's going too fast. So one thing I want to note, a healthy rate of weight loss, even if you're not on a GLP-1 medication, is roughly 0.5 to 1% of your body weight. This roughly translates to 1 to 2 pounds per week for somebody, again, depending on your body weight and your BMI. But this is partly why we go slow with these medications, and we don't want you to be losing a massive amount of weight when you start. I have a lot of patients complain, I started this medication today and I haven't lost any weight. If you dropped 10 pounds in one day or in 1 week, I would be sending you to the hospital. That is concerning. And this is one of the reasons why, okay? So, the symptoms for this include right upper abdominal pain, nausea after fatty meals, and pain radiating to the shoulder or the back. And this is still for gallbladder issues, okay? These symptoms warrant medical evaluation, so please go see somebody in person. Pancreatitis is rare but serious. GLP-1s can cause expansion of the pancreatic duct glands, which may lead to the obstruction of pancreatic ducts, resulting in inflammation. And this is also a result of reduced gallbladder motility. So they kind of go hand in hand here. But symptoms of pancreatitis include severe abdominal pain, persistent vomiting, and pain radiating to the back. This is, again, uncommon, but it is a reason to seek immediate care if you experience this. And this is also a reason why it's, depending on where you're getting your GLP-1 medication from, if you have a history of pancreatitis, the provider may not be comfortable with prescribing a GLP-1 medication to you because of the history of pancreatitis. It can lead to a reoccurrence of pancreatitis, and they want to avoid that. And then vision changes. Vision changes with GLP meds may actually be more related to concerns for hypoglycemia. The idea is that the body is not getting enough nutrients or sugars in order to use, and therefore the vision changes can occur due to the lack of the blood supply or the sugar being supplied to the optic nerve and the retina. Okay? Symptoms include blurry vision, double vision, or even vision loss. And if you're experiencing these, please go get evaluated. So, to reiterate, this is why dose titration matters. Most side effects occur when doses are increased too quickly, people eat beyond their fullness level, and hydration and nutrition are insufficient. Slow titration allows for GI adaptation, mentality and lifestyle adjustments, and better long-term tolerance overall. So from a nursing perspective, slower is often better. We want you and your body to adjust to these medications in a healthy way so that you can then ideally maintain what you have lost. So, my key takeaways for you. Most GLP-1 side effects are a direct result of the medication's mechanism of action, slow digestion, and altered gut signaling. Many symptoms improve with time, lifestyle adjustments, and hydration. Side effect management is about supporting the body, not fighting it. Side effects are information, not failure, but ignoring them can lead to worsening presentations in the future, and this can then ultimately set you back in your goals as a result. GLP-1 medications change how the gut and brain communicate. Side effects are often part of that transition, not a sign that something's wrong. Understanding what's happening in your body allows you to respond with strategy instead of fear. If this episode helped to clarify GLP side effects for you, please share it with somebody navigating these medications. Like and subscribe and send any questions that you have. Thank you as always for listening, and I will see you guys next week.